Ever wonder how many teens are affected with HIV/AIDS here in the Metro Washington, D.C. area?
There is an HIV positive student in every DCPS classroom.
That's how the director of the health curriculum for D.C. Public Schools, Deanna Bruce, can best outline how big an issue HIV/AIDS is and why education about the virus is so important.
And then they're having more sex in a city that has more infection.
And there are people making careers of informing the community.
It could be the most gorgeous girl, but do you know what they're carrying inside? Can you tell if a person has HIV? Not right.
Maynard Correa has spent the last 2 years going from neighborhood to neighborhood here in and around the Washington, D.C. area, talking to people about HIV and AIDS. As a health educator for Planned Parenthood, he says it's a topic he's passionate about.
It's about educating our people about being aware that the virus is actually happening and going on around.
HIV, the human immunodeficiency virus, and its more severe form, AIDS, have not been at the center of media coverage as they once were, but it doesn't mean the virus has gone away. With roughly 1.2 million Americans diagnosed with the virus, it is still an epidemic. And which group's numbers are rising?
It will be African Americans followed by Latinos, especially when it comes to that. It will be the females will be the most affected ones, aged between 14 to 24.
With 5% of the population in the Washington, D.C. area, we've got the highest rate of incidence in the country. And experts say it's going up. D.C. outdoes California, New York, and all of West Africa. There's still no cure. So what do you do when you've been diagnosed? One place victims of the virus have found refuge is here at the Whitman Walker Clinic. Staff here say this location opened its doors in 1993 and sees more than 3,000 HIV/AIDS patients a year. And Pernell Williams, who manages patient health care and education, says that it isn't just the virus that's life-threatening, but the other diseases HIV-infected people are vulnerable to.
There are things that we call comorbidities. A lot of times clients or patients with HIV are patients with diabetes or heart disease, and some of the drugs, the prices for some of the drugs do compound.
He agrees that the cost of drugs and care is still expensive, but goes down as the patient's overall health improves.
A lot of the drugs for HIV are more expensive, but as time goes on, more and more of those drugs can be offered on a generic basis, and we're looking forward to that.
While there are funding sources available for patients needing help paying for their life-saving drugs, many advocates say there is still a need for federal policy.
With reform in health care, you'd expect that then more people would be able to access treatment and care, which is very important. A lot of people drop out of care.
The first case of HIV/AIDS was recorded on June 5, 1981. It was the same year that Edward Harris heard the news.
Actually, a lot of people don't know this, but I know who I've contracted it from.
He says there's so much more he knows now that just wasn't understood about the infection then.
Back then, it wasn't like a whole lot of talk because a lot of people were very scared and they didn't know, what was going on. People were dying very fast. We only had AZT and 3DC as medications, and they weren't working well, and they were really very experimental, so they were just seeing where they would go with them.
So here are the ABCs of prevention.
Abstinence.
Be faithful. Use a condom. If you use drugs, don't share your needles.
At 57, Mr. Harris has lived with HIV for 28 years. He is now an outreach spokesperson for the Whitman Walker Clinic.
And I think I've been blessed because like I say, I'm all over the city. People stop me in the street and say, I saw your picture on the bus, sir. You look very good. And I say, did you read the caption? That's what I want you to see, is the caption.
While it's possible to live a relatively healthy life with the HIV infection, educating yourself on prevention can be the best cure.
Protect yourself, regardless of the other person. If the other person say no, and you protect yourself, you're still protecting the other person, whether they believe it or not.
Whatever you do today will have an impact tomorrow. Not tomorrow, probably in a month, 3 months, a lifetime.
Reporting for School Without Walls, Tarisha Jackson.